I always tell patients at least 2 to 3 times a day, but the more the better. The patients who are in our office using it 5 or 6 or 7 times a day or more look fantastic that first week out. And when they come in, their vacuuming is very easy. They really don't have a lot of crust in their nose, and they're feeling better, but at least 2 to 3 times a day. Hey guys, it's Dr. Samir Undavia from NJ ENT and Facial Plastic Surgery. And today I wanted to talk to you about 3 tips that can be helpful for recovering from nasal surgery. So obviously I want you to listen to your physician, make sure you follow their instructions to a T, but here are 3 good things that can also be very helpful. So the first 2 are about hydration. Your nose reacts to surgery as though it has a cold, and it just pours out a ton of mucus. And there can be swelling, there can be some old blood in there can be some scabs in there. And if the mucus just kind of sits in your nose, it's going to build on those scabs and completely clog up your nose. So the more you can hydrate your nose and get this stuff out and kind of make it easier to get out, the better. And most of us surgeons don't want you to use blowing your nose to get that out. And the reason is there's about a 2 to 3% chance of a nosebleed after nasal surgery. And if you blow your nose, that risk goes way up. So instead, we have you wash out your nose. So using lots of sinus rinses can be very helpful. And when you use sinus rinses, you got to make sure you don't just put in water. You got to put in the water and the salt packet in there because it's got to be the right concentration. Otherwise, it makes you more congested. So use the salt packet, use distilled or boiled water, and use the sinus rinse really pretty often. I always tell patients at least 2 to 3 times a day, but the more the better. The patients who are in our office using it 5 or 6 or 7 times a day or more look fantastic that first week out. And when they come in, their vacuuming is very easy. They really don't have a lot of crust in their nose, and they're feeling better. But at least 2 to 3 times a day. The second thing I like to use is like a saline gel or a little bit of Vaseline in the nose. It can also be very helpful in clearing out all this mucus and just feeling a little bit soothing. So all this crust that's sitting in your nose, you're trying to get out the sinus rinse, but there's always a little bit that's still left over, and it can make your nose feel very dry, especially in the beginning. So what we do is we use this nasal gel. It's just saline in a gel formation, and it helps to soothe your nose a lot. And you could use that in between the sinus rinses. You're really just trying to keep your nose super wet. And then the third thing I have, which I've done more recently for our patients, is tape their nose afterwards. And this is really mainly for the rhinoplasty patients. So here's what I usually tell everybody during their pre-op and their consultation. If your nose is going to be about this big when all the swelling is gone, it's like this big when we take the cast off, especially from the front. The side view looks great. Sometimes there's swelling, a little bit of rotation, but it really looks great. It's the front that looks super wide. So if it's like this, over about 2 months, it comes down 50%, and it does it like this. At 3 months, you're about 60%. At about 6 months, you're 80%. And by a year, you're 90%. So it starts off super fast, and then it slows down through the course of the year, and you're not done at the end of a year. There are some surgeons that say you're never done. It's just constantly an evolving process. We usually say by 2 to 3 years, you've gotten at least like 97, 98% of your result. But where it lingers, whereas the swelling lingers, is right around here. So what we've told patients is that we give them tape to go home with, and at their first post-op visit, we teach them how to tape. And if they can tape at night, their recovery is so much faster. So instead of being 50% at 2 months and 80% at 6 months, they kind of look like they're 50% at 1 month or 3 weeks. And by 2 months, they're looking like they're 70, 80%. They're just on a faster curve. And so by the end of the year, they're looking even better, or at least they're feeling so much better about their nose early on. It really keeps the amount of steroid injections, the amount of Boli calluses that we have to shave down to a minimum. It helps so much. And so long as you don't get acne or you don't get a skin sensitivity with the tape, you're fine to use it at night for as much as possible. I have some of our patients who work from home. They use it all day and they love it. They love it. They don't have to use it for the whole year. They don't even have to use it for 6 months. But if you do it early on a lot, it helps a lot. So those are 3 tips for a speedy nasal recovery.